Welcome everybody. Welcome to this first Movella Sports Conference. The Sports Conference is about combining sports and kinematics. And today our aim is to give you valuable insight into different tools that can be used and combined for performing analysis in research and in sporting environments. This also includes a detailed look at the latest innovations for measuring human motion in sports, such as EMG, force plates, but also software applications that can calculate kinematics. During this sports conference, our speakers will share their insights about the technology and the application in motion capture. We hope that by showing the innovative combination of analysis tools for researchers and sports scientists, that they will learn new ways to investigate an athlete's performance capabilities. Good afternoon, everybody. Welcome back to our next session. This session will be the session from Top Biomechanics, in which Alex Moorhead and Jorge Storniolio will be talking about inertial sports kinematics.
So hello, and thanks everyone for joining us today. We'd like to take a moment to thank Movella for hosting this conference on combining sports kinetics and kinematics, and for giving us the opportunity to present alongside some of the industry leaders in sports research with Xsens, Xsens, the University of Amsterdam, MyOnTech, anybody, Predimo, Kinetic Analysis. Of course, we also want to thank all of you for joining us as attendees. It's our honor to be here, and we're grateful to showcase the work that we've been developing over the last couple of years at Top Biomechanics. Today, my colleague, Dr. Jorge Storniolio, and I will be presenting about our application of inertial motion capture for kinetic data acquisition and how it can be applied to sports performance enhancement and injury prevention. To begin, I would like to briefly introduce who we are at Top Biomechanics. While this company has been a collective effort of many friends, colleagues, mentors, athletes, and coaches, our three most prevalent and consistent roles are Jorge, who has not only been a great source of both scientific and sports research background, but also of support and encouragement. We'll be hearing from him later. Next is Carlo Epifanio. He was a major component in the original establishment of our group and has been fundamental not only in the communication with our athletes and coaches, but also the ongoing logistics of organizing nearly 20 people across 2 countries and 3 different cities. While he's unable to join us today, his contribution to this project is absolutely priceless. As CEO, I do my best to keep up with these two behind the scenes with handling the bureaucracy, protocols, and data analysis. I think I speak for all of us when I say we're very excited to be here presenting the fruits of our labor. Today, we aim to help our clients and each other to obtain the prize through the continual pursuit of improvement. As a quick introduction, I'm from Colorado Springs and have been professionally pursuing science behind sports for nearly 15 years since I started my bachelor's degree in 2008. At the University of Colorado Springs is also where I met my master's supervisor, who was a former senior sports biomechanist at the United States Olympic Committee, and who introduced me to the world of musculoskeletal injury biomechanics. I continued to study with him to earn my master's in biomechanics, studying the dynamics of pitch over accidents with different bicycles and rider positions and anthropometrics. Simultaneously, I was hired to work at the United States Olympic Training Center in sports medicine, where I established their biomechanics testing lab and wrote the protocols still used today for their elite athlete health profiles. While that was one of my favorite jobs to this day, I knew I wanted to deepen my technical and research skill set, so I came to Milan to earn my PhD, where I got to work alongside Jorge and Professor Minetti at the University of Milan studying physiomechanics of locomotion. More specifically, my thesis was concentrated on the internal work of friction with human joints during locomotion. Upon completion of my PhD, I was hired at the Politecnico of Milano on a collaborative research grant between the Department of Mechanical Engineering and the Department of Electronics, Informatics, and Bioengineering under the supervision of Professor Taravini and Professoressa Galli. Here I worked alongside Dr. Zago, who worked on studies on everything from coordination in youth soccer to whole body vibration for obese patients, workers, and even canine gait using inertial measurement units. One day while working there, I was fortunate enough to meet Felix, who also works at Xsens, and from there on, we've developed our professional relationship to now come to be Top Biomechanics, and we developed the projects which you'll see today. So at Top Biomechanics, we have an extensive relationship with sports, from training to competing to coaching, and all different sports from American football to volleyball, soccer, and we even had Carlo as a nearly national athlete in sports in track. But as I began my master's in biomechanics, I was given the opportunity and the curiosity to work on improving the performance of Olympic athletes, and was able to quickly realize that this tool is valuable to everyone and potentially even more applicable to the amateur athlete. Professional athletes set the bar for the highest performance and give amateurs a guideline for what to strive for in athletic performance, but by investigating them at an objective level, you can get those pros new ways to improve and stay healthy while also providing tangible benchmarks for the up and coming amateurs. Coaching is one of the most difficult steps because you have to combine research grade technology and expert training, but that's where Top likes to come in. We like to bring the bridge between this research grade technology and the coaching so that you can get a tangible result for your athletes. So how do you do that? We've got the different options of motion capture, everything from video to mobile apps to inertial motion capture, markerless, marker-based. But one of the great things about Xsens is you get clean data, you get convenience, you get reliability, and it's something that you can use on the field of play. So how do you apply kinetic motion analysis to performance enhancement and injury prevention? Well, it can be applied to nearly, if not every sport in one way or another. And of the most exciting aspect about working in sports biomechanics is that you can work with a certain sport or athlete. The probability is high that someone has already started to lay the foundation for you to follow. As a biomechanist, our job becomes finding the right test to answer these questions being posed and then creating an analysis to find the answer. Here, there's a very short list of published literature topics applicable to both performance enhancement and injury prevention of today's topics. While Jorge and I would like to give an in-depth explanation of all the tests we performed and results found, unfortunately, we don't have the time to cover everything. So we've chosen some of the more interesting and straightforward examples with two of our client cases. During the course of the season, we tracked the functional health and performance of 12 junior tennis athletes in Rome, Italy. There were 3 rounds of tests, approximately 3 months apart, starting at the beginning of the season, then returning to the middle and end of the season to obtain a full overview of each athlete. We performed tests which evaluated not only their general fitness, but also their ability in sport-specific tests. This included mobility in their upper and lower extremities, service, agility, and jumping. In relation to the previously mentioned literature, we'll be looking at 3 functional evaluations that we performed on our tennis athletes to create a profile of their health and performance. The idea of doing a functional evaluation is to take the gathered data and confront it with what muscles create those movements to understand where improvements can be made. As most of you likely know, the shoulder is quite an impressive joint for its mobility in both the sagittal, frontal, and transverse planes. However, that mobility also comes at the price of being highly unstable. As you can see here, there is actually no bony support to maintain the position of the humerus within the glenoid fossa of the scapula. It is held in place primarily by the rotator cuff muscles, as you can see here, the supraspinatus, infraspinatus, teres major, and subscapularis, along with the labrum and a series of other ligaments, tendons, and musculature. However, as those muscles are used repetitively, particularly like in tennis or with improper kinematics, can lead to increased injuries and decreased performance. It's important to consider the amount of torque which gets placed on the shoulder joint when having to accelerate the tennis racket. While shoulder mobility obviously includes flexion, extension, abduction and adduction, and rotation, internal and external rotation of the shoulder has been correlated with performance. Additionally, decreased internal rotation has been found to be significantly more prevalent in the dominant arm. To ensure healthy shoulders and increased performance, periodic mobility exams are recommended. Typically, shoulder range of motion exams are performed by subjectively evaluating subject's ability to perform certain movements or by using a goniometer. However, even with a goniometer used by a professional, it's easy to introduce bias between clinicians and or between readings. With a calibrated motion capture system, any bias which may be introduced will be the same regardless of the user or testing system. This allows for creating healthy baselines, normative values, and longitudinal studies. Additionally, it allows the assessment to be done outside of the clinic and immediately move to other evaluations without the need of other tools. Here we show how the procedure can be done in the field of play. By sitting on a chair, the athlete with sensors and the arm placed at 90-degree abduction with 90 degrees of flexion at the elbow, the range of motion of the shoulder can be tested by starting with the forearm parallel to the ground and asking the athlete to actively rotate his shoulder upward and downward without pain by or forcing while the investigator stabilizes the scapula. The results of shoulder range of motion are always interesting to me. It's one of the exercises that, at a glance, shoulders seem symmetric and healthy, but when you look at the results, you can often find unexpected results. As in this subject, the screenshots seem almost identical between the left and right shoulder. However, when you observe the number from the motion capture, it becomes apparent that the left shoulder, in this case non-dominant, is actually less mobile on average. Here, the positive numbers shown internal rotation and negative represents external rotation. As mentioned in some of the previous literature, the dominant arm of this athlete has less internal rotation. This may be attributed to overtraining of that arm, or it could be simply due to a tough day of training serves. This has to be paired with training to better understand. While the athlete may not be complaining of pain, this may be a pre-indicator of injury risk, and continuing without addressing this could lead to a decrease in performance. The next functional evaluation is that of the overhead squat. The overhead squat requires bilateral leg stability coordination of the whole body and the whole body stability. By watching the overhead squat, you can reveal asymmetries and instabilities if there's a weaker leg. In addition, it also reveals hamstring and quad deficits when looking closer at the data. And when there's instability within the ankles and decreased range of motion, that will translate upward through the knees and hips. So to perform an overhead squat, we have the athletes do 10 overhead squats while holding a lightweight broomstick, not to add any sort of weight, but simply to maintain the position. We have them maintain their elbows at 90 degrees of flexion and are told to squat as deep as comfortable without losing balance. They're given 3 practice squats before beginning, and audible cues are given for frequency, such as dip, dip. That way they make sure that they follow the same frequency. Here I've added green bands to the figures to represent what values of mobility should be ideally reached. It can be seen that both the knees and hips are able to exceed 90 degrees of flexion, and the dorsiflexion of the ankles is greater than 35 degrees, all of which, according to the literature, are indicators for healthy range of motion. The next parameter to observe is the symmetry between the legs. This symmetry graph shows 2 parameters in one. The diamonds represent the mean of the maximum flexion moments of all the squats in each leg. In the middle, the smaller circle represents how much the subject favors one leg or the other, with the associated percentage difference. The green band shows the ideal range of a 10% difference. Once again, the hips and knees show healthy range of motion, as both are within the acceptable range. The ankles, however, show a slight deficit in right ankle dorsiflexion, but this is likely due to a smaller range of motion, and other exercises should be considered before raising any concern. So the next test which you can do are lunges. To investigate the lower limb health and performance of the legs, you can do front and side lunges. By isolating the hip and knee flexors, you can start to better understand the range of motion and the instability within the lower limbs. Doing a lunge requires independent leg stability. It will reveal the asymmetries and instabilities if one leg is weaker than the other. While doing a lateral lunge indicates adductor weakness, the front lunge indicates hip and knee weakness, or even flexor and extensor weakness. The ankle range of motion here can also be indicative of decreased performance. So to do the lateral lunges, it was similar to the overhead squat for both the lateral and the front lunges. We had them do 10 alternating lunges, front with the left, front with the right, or lunging left and lunging right. The hands were kept on the hips to avoid any sort of stability with the arms, and they were told to lunge as deep as comfortable, similar to the overhead squat. They were given 3 practice lunges before beginning and audible cues for frequency. Here, similar to the overhead squat, we use the green bands again to indicate the desired range. We can see that both the hip and the knee show decreased range of motion compared to the overhead squat. That is not necessarily of concern, as the overhead squat can typically result in higher range of motion. Additionally, both stay above 80-degree minimum threshold. One big difference, however, is a large decrease in ankle dorsiflexion, and the subject continues to show greater average dorsiflexion on the left. That, paired with the decreased left hip flexion, may indicate weak hip or knee extensors. To look at the lateral lunges, it's similar to that of the front lunge. However, the hip flexion and similar to decreased left hip flexion compared to the overhead squat. They also maintained high knee range of motion, and in this exercise actually recovered their low ankle dorsiflexion. So it seems that while doing the lateral lunge, they have no issues with their range of motion as opposed to the front lunge, which may say that they don't have any problem with their adductors, but may have problems with their extensors of the hip or the knee. Here you can see that in this case, almost all of the symmetries have returned, except for now you see a slight preference to the right hip flexion, and this may be due to issues with the knee or the ankle dorsiflexion. Comparing the two lunge emphasizes weak hip and knee extensors as stated. The next options of how to approach sports research with kinetics would, instead of be doing an evaluation of the general functionality, look at a specific test. This could be the agility, a single leg jump, or service. As mentioned previously, while agility is important in tennis and the single leg jump tells us a lot about lower limb power as well as landing kinematics, we've chosen to present only the kinematics of the serve for today's presentation. Of course, if there's time for any questions today, or if you would like to reach out to us in the future, we're more than happy to discuss more parameters in depth. The tennis serve is commonly divided into phases of cocking and acceleration before the racket impacts the ball. Each of these phases also has specific kinematic parameters to be evaluated for injury and performance. Many of these have been studied at length by several groups and provide good baseline numbers for how to evaluate a tennis serve. Since the tennis serve is initiated from the ground, if even one of these parameters is off, it can lead to inefficient movement and decreased ball velocity. To study the serve, we had each of our athletes do 5 first serves and 5 second serves while aiming for a target with points. Serve speed was monitored with a high-speed camera, and they were given 3 practice serves before beginning. Here, as with the previous graphs, the green bands indicate where the athlete should aim to be according to the literature. As can be noted, the athlete exhibits both excessive shoulder abduction and elbow flexion. Meanwhile, the external rotation is far less than it should be. If you can remember from the shoulder slide, there's very little support of the shoulder, and having it in these positions causes the athlete to try to generate racket velocity using the weaker shoulder girdle muscles instead of recruiting the greater muscle groups at the front and side of the torso. This leads to lower performance and high risk of injury. The surprising part of this is that the athlete was one of the stronger competitors within the group. Of course, to get an entire view of the kinematics, it's important to investigate the lower extremity. Looking quickly, it's already apparent that this athlete's lower extremity is much more in line with the desired parameters. The torso rotation and torso flexion both fall within the desired range, as well as the knees, and as well as the left and right knee. This is to say that the forces which are being generated from the ground to initiate the serve are being done with very good form, which almost makes up for the mistakes generated in the upper body. Now, if the athlete simply maintains the lower body kinematics and concentrates on correcting the upper body kinematics, the service could greatly improve. So what are the take-home messages of this? This athlete overall has great range of motion. There's no issues aside from potentially some issues in the ankle dorsiflexion, which may not actually be an issue. It could possibly be that they tripped or had a small injury, or it could be something to look for. You also have to pair it, as said previously, with the training. Potential for improvement does come, however, with the hamstrings and, as mentioned, the ankle flexion. With the hip extensors and knee extensors, it's important that they strengthen these so that the athlete no longer has weakness in that front lunge. In addition, as shown, they're lacking in upper body serve kinematics. Primarily, the elbow flexion is the largest concern. When thinking about the elbow, which gets highly flexed, typically you want to have the elbow actually extended no more than 60 degrees of flexion throughout the serve. This is causing excessive movement of the elbow and also creates issues on the back of the arm, on the tricep. They obviously have strong lower body kinematics, and when you combine that with the upper body kinematics, if you can correct them, just small changes in the upper body kinematics can make a big difference. I would like to thank you, and if you have any questions, you can ask them. Otherwise, we'll pass on to Jorge.
So good afternoon, everyone. First of all, thank you, Alex, for the presentation. Let me introduce myself. My name is Jorge Storniolio, Chief Research Officer of Top Biomechanics, and I will present today our work Inertial Sports Kinematics for Performance Enhancement and Injury Prevention applied to a football player, a case study. First, a direct approach to my context. I'm Brazilian, so only with this information you may conclude an obvious thing. Okay, this guy, he's a football lover. And you are completely right. I come from Porto Alegre, south of Brazil, surrounded by one of the most famous football rivals in South America between the football teams Grêmio and Internacional. Here are they. Thanks to that, I could breathe football since my first steps as a dreaming little boy to become a famous star. But destiny wanted a different path to my boy dreams. Currently, I'm a researcher at Università degli Studi di Milano in Italy, where I'm in charge of the laboratory of neurophysiology of the vegetative system and exercise. Besides, I'm a professor with a teaching contract for human physiology to a degree course at the same university. Anyway, this path sounds quite different from that dream when I was a little boy. Luckily, I graduated in sports exercise, which helped me put into practice my desire to work with football. In parallel, I work with football as a coach, and thanks to Top Biomechanics, I could put the theory and the practice together. Okay, if you want to talk about football, we can take into consideration it as the other sports context to do at all, from a recreational or as a performance point of view. In general, only positive aspects we can associate to football's practice, which includes benefits from the cardiovascular system and metabolic consumption beyond that reducing risks for lifestyle diseases. However, its overtraining or dysfunctional movements may induce a significant chance for injuries based on contact or no contact situations in the field. This sport requires constant indicators based on technical skills and physical responses to determine how high the player's level is from a performance standpoint, of course. Both the capacities may respond. Why can you see a lot of players with poor ability playing at so much high level? In parallel, we may do the same question. How is it possible a fragile player play along to muscle guys? Thanks to these contrasting characteristics, the football practitioners, and here I'm specifically talking about the staff that works with this sport, not the players, are looking for the best athlete, that player which can gather both conditions and perform at the top level for many and many years. Then, combining both these factors has been challenging for football practitioners since physical evaluations have gained greater attention due to more precise techniques developed over the last decades. Nevertheless, these elements can respond only to one part of our problem. They cannot cover the technical skills specified, for example, by ball control, passing, dribbling, shooting, and defending actions. This issue raises the question, so how to create or promote a measuring method to identify performance football players by their specific abilities? We know that the technical counterpart of maximum oxygen consumption, lactate threshold, heart rate variability, rating of perceived effort, and others are the technical gestures and football movements with and without the ball. Unfortunately, success in football is not only associated with performance. Therefore, we also must consider the player's capacity to perform at high level without suffering from injuries or support the pain for keeping their working at the top level as long as they can do. It has been reported that injury rates in football players are average at 8.1 every 1,000 hours of exposure, including training sessions. This data comprises contact and non-contact game situations. The Federation International Football Association, FIFA, has promoted a training program to avoid injuries in football players comprising all levels, from amateur to top players. This program includes simple movements and exercise performed 15 minutes before training, especially during the warming up. The program is considered a good tool because it had interesting results over reduced overall injuries by 39%, beyond that a specific reduction in hamstring injuries by 46%. On the other side, some questions have been raised since then. The efficacy of these results is still unclear. It is considered a general exercise program since it does not address personal issues regarding players' positions and characteristics. Then the injury profile and its incidence may vary across the different teams and leagues worldwide. Based on that, we of the top biomechanics thought to combine our expertise to gather all the information regarding updates, training programs, injury preventions, performance indicators with the practice. We know that our work these days is a challenge due to difficulty of translating this evidence to football practitioners. Luckily, we are moved and inspired by challenge. So besides creating a detailed program to evaluate a football player, we accepted the challenge of developing a specific bridge between the research and the people who work backstage. Then we aimed to create a program for football players targeting the performance improvement and the injury prevention. For that, we needed something different from what has been proposed by the market as the usual optoelectronic systems and widely used in the last decades on biomechanics applied into sports science. So our claims to go forward with the project required a low-cost functional tool combined with a reduced number of materials needed beyond avoiding the indoor conditions and then conditions and this consequent unsafety feeling due to not using specific boots, for example. Thanks to Xsens, we could program this project because it allowed us to think about specific tasks for football players. The simple fact to dress a suit which makes the movements more natural without concern with extra materials dropping off from the body or a short space for displacement became our aim much more achievable. As you can see, for example, from the video, this is an example of one test applied at the system. Look at the facility to obtain position data from each segment of the body, and after that, we have to calculate different variables from biomechanical models, of course. Our subject, for privacy reasons, will be identified as RI. He's a football player who plays in Italy's first division. He plays as a defender and has the right foot dominance to perform kicks and passes, usually during a game. Also, physically, he has 1.87 meters and around 79 kilograms. In the current season, he's considered one of the players with more presence in the Italian championship, with 23 matches and almost 2,000 minutes has played. The data collection occurred in March of last year. This period is characterized as an mid-season for players. The test battery was carried out in a non-official football field, outdoors and with natural grass. We proposed a setup comprised of 10 tests. All these tests involve physical and technical situations, which he should perform as best as possible. During all the protocol, he should dress the Xsens suite with 17 inertial magnetic measurements units attached to body segments to measure directly linear accelerations for each segment and 3 orthogonal axes. This design enabled us to collect his movements during all the tests proposed. We will report you tests whose results could be compared to those reported in the literature for a logistical choice. All the tests selected without the ball will be presented from a performance and injury prevention point of view. Then we start to talk about the sprint. We know that this movement for a good performance requires a precise technique to differentiate every subject in a homogeneous group. These characteristics include the upright trunk, the arms flexing in phase with the opposite leg on the sagittal plane and not in the frontal plane. Also, it has been added a more neutral pelvic position associated with a higher knee lift position is a reason for a sprint in a shorter time. All these features could be correlated with kinetic behavior such as a lower braking phase and anterior-posterior components of ground reaction forces. In parallel, it would be expected higher vertical components of ground reaction forces will likely be promoted by a higher overall stiffness and a reduced distance duration. Here we could verify from the video our player has a leaning trunk with a consequent lower knee lift position in respect to the chest due to this fact. It also has a significant arm flexing in the frontal plane, increasing arm resistance. We expect that these indications may promote through a correction training his improvement by a corrected posture and this specific task. From an injury risk point of view, mainly associated with a hamstring strain, we pointed to the lower interior pelvic tilt, the consequence of a leaning trunk, since this aspect might indicate moments where the hamstring muscle tendon unit faces the highest mechanical strain during sprinting. Then we might detect a significant risk. Regarding the curve sprint, it has been demonstrated this action corresponds to 85% of activities performed at maximum velocity during the game. From a technique perspective, this performance may be divided between the good and the weak sides regarding the completion time to cover its distance. The difference between these sides is recognized as asymmetry. The higher the asymmetry, the higher the differences between the preferred and non-preferred sides. In addition, we depend on the intrinsic characteristics related to this performance, the concept of outside and inside leg. The outside leg works as a steep side maneuver, while the inside leg usually responds with a higher contact time, emphasizing it, especially on the weak side. We cannot define the asymmetry as a significant response to performance for the curve sprint. Still, we know that reducing asymmetries would not result in faster speed or change of direction times. However, being equally fast in both directions would provide an advantage, given the unpredictable nature of football actions. Our player demonstrated a medium level of asymmetry this guy, of asymmetry comparable to professional players of his age. Nevertheless, it is always a veiled passive improvement, particularly to the left side. As expected, he presented a higher stance time for the side leg in both conditions, but with a slight difference in the weak side. This result might indicate that future improvements in his workout may increase this difference to a better performance. We choose to show you the cutting on 90 degrees because of its importance to performance and injury prevention regarding the change of direction. It has been reported that the change of direction involves braking in the original direction of forward progression, translation, and reorientation into the new approach. A better technique is that action that enables a longer stance time in a more extensive medial ground of reaction forces to accomplish the greater redirection demands. In equivalence, an increasing trunk lean into the cut is expected combined with a hip internal rotation. This behavior promotes a following execution phase with faster acceleration. However, our player responded better towards the right side. Since he demanded a shorter completion time for the test, accompanied by a shorter stance time and better technique among the different phases of this movement. We can follow the sequence accomplished and on the left side. As you can see, he spent more prolonged braking during the approach, which results in the more extended translation, followed by a push phase coordinated from the inside leg. In the end, it might require a significant abduction moment, which can be dangerous to the knee. Observe that possible increment on the knee valgus loading could respond to a risk of injury in the anterior cruciate ligament because of this movement. As this action is reproduced many times during the game, his staff has received a warning from our reports. The technical gestures, such as passing the ball, were evaluated based on qualitative analysis matched with quantitative data. Our player did not demonstrate a good execution for this action, we have to be honest, and he probably does not have the passing as mainly demanded during his career as a defensive player. Anyway, if you want to get in the same direction as a modern football, he will need this ability to maintain himself at the top, of course. To accomplish that, we proposed correction on his posture, such as upright trunk during the contact with the ball, beyond the natural pelvic position through a significant knee extension and the support leg during the moment in the contact of the ball. The graphs indicate the flexion of the test's hip, knee, and ankle joints. We could confirm the qualitative analysis due to higher values reported in these angles. Meanwhile, his performance was not much better than passing during a kickball, but at least confirmed a higher kick power. We know that power and precision are not linear correlated themselves, which could respond better depending on the target. For example, a higher kick power will be required if you point to a top target, accompanied by a more dorsiflexed ankle. Simultaneously, if you aim for a bottom target, it will require a smaller ball speed for higher precision, corresponding biomechanically to a lower knee extension. In conclusion, our general work reported a possible risk to the left knee, mainly during cut movements, evidencing its role as a support leg for the translation during this movement, not as a pusher for the execution phase. Besides, we could indicate to his trainer the need for a better trunk position regarding the sprint associated with the arm movements working in a sagittal plane, beyond the necessity of upright position during ball passing and cutting exercises. The specific report comprised the other tasks excluded from this presentation and highlighted other qualities and warnings to the better progress of his private training. Thank you for your attention.
The question is, how is your injury prevention program subject tailored? An example, medicine's most acknowledged challenge is to tailor testing/treatment to each patient. I refer to subject-specific anatomy as well. So how is your injury prevention program subject tailored to that?
This is a really good question. Thank you for your question. Actually, we don't know yet at all because we made this project. We created the project for specific and one guy, the one player, and that we did it just once. Okay, so we are expecting during the season, and now it's going very well because he hadn't have no one physical issues or injuries or something else. So to be honest with you, and we are preparing, we are experimenting our injury prevention for a specific football player, and that is going well for now. We hope that's going like that for the future also as well. I don't know if Alex would like to.
Yeah, if I can just add to that, I think from the same perspective, sort of going off of what Jorge said, really what we performed for that soccer player, that football player, was customized, and it would be the same approach for any other soccer player that we might, or sport that might approach us. If somebody said, okay, we have this athlete who plays this position, and we want to understand what their current health profile is or performance profile is, there are sort of a functional evaluation, a series of tests that you can start with, and then you can do specific movements, as I showed for the tennis tests. And in fact, while I didn't talk about it, there was months of planning that went into the tests which were chosen there. And had I talked about, for example, the agility, a typical agility test would be doing a T-test, which is what we did with our soccer athlete. However, if you think about a tennis athlete, they're not going to be running the same distance as a soccer athlete would. And so we had them doing more back and forth and then left and right. So every test, let's say, is actually meant to be tailored to the athlete who asks or the team that asks for our consulting.
And besides that, all these tests have already proposed in the literature, specific literature for this specific sport. So from the tennis, from the football. So if you have to test for a different player from basketball, for example, we have to try to looking for the same tests already proposed from these sports to get that, and of course evaluate if it's possible or not to apply for that specific athlete.
Okay, very good, guys. Thank you for this elaborate answer. It's very clear, I think. There's another question from Bernadette van Os, and she has the question, with all this information you collected, what do you advise professional sports teams to implement in their workflow in regard to their daily program, but also what would you recommend for testing?
This is a great question, and it's exactly what we aim at solving, really. I'd say the short answer is to get somebody like us to come help you. The idea is you want to have somebody, if you don't already have a dedicated sports scientist, you want somebody who knows how to use this sort of technology to get an objective perspective on what the coaches and physiotherapists and trainers are already subjectively understanding. So if you can get somebody who is able to use this and then develop it into a sort of, let's say, athlete management system, sort of like you have with Conduct, if you are able to track this over time, that's the best way. Is you start simple, is you start to get baselines. And I think one of the most important things is to have the numbers before athletes are injured, because it's also really great for not only injury prevention and skill, but for return to play, because unfortunately, sooner or later, somebody will get injured. And if you've got those baseline numbers, you can say, okay, they've reached 20, 40, 60, 80% of what their baseline is. Now we can send them out to train again. So the long answer is get somebody who is trained in it. Short answer is just start. You have to have somebody who can understand with a little bit of literature how to test these people and start getting baseline numbers.
Mm-hmm.
Thank you, Alex. It's really clear. I have another question from Mariam Abu Alim, and she asks, to what extent does arm movement affects balance during a ball pass? So I believe this one is a question for Jorge. So what do you think about that, Jorge?
How extended is the movement specifically from the test, you mean? Extended the time? Okay. The time course?
Sorry. The question was, to what extent does the arm movement affect balance during a ball pass? In soccer, I believe, because ball passing with a tennis racket, a little bit different. So can you answer that, Jorge?
Okay, if I understood well, about the balance between the difference in the ball passing and the service in the tennis. Is that right? No, I'm sorry because No, because I couldn't hear well. I'm sorry.
He was just wondering, my sound is not okay. How much an arm movement, or pardon me, can affect the balance while passing.
The arm movements. Okay, I'm sorry. I'm sorry. I think depends on maybe depends on the height of the player, because trying to get balance during this movement, we have to start from the basis. Okay, so the support leg prefer the close to the ball. Okay, so if you have to pass with the right leg, I can think that my support leg, my left side, my left leg could be close to this ball. Okay, to try to get a more balance from the bases. Talking about the arms, I think that could be more complex, because you know that every player has a preferred way to take this movement. So there are players with using more space with the arms, and there are players that practically don't use the arms for anything. Okay, during the ball pass or during the kick. So maybe we can make an experiment trying to understand how is the difference from the balance during the ball pass, using or not the arms, because we already know there are, for example, studies using the difference between the high power from the use of the arms for a jump, for example. But this is another aspect. We know it's a jump power, not balance. No, this is a really good question anyway.
Okay, thank you, guys. There's another question from Tracy Wehrman, and she's asking, what calibration model are you using to calibrate the Xsens system? So maybe it's a good question that I can maybe answer. For Xsens, we have a calibration procedure which consists basically of two parts. We have a static calibration, which is our neutral pose, which basically is standing with your feet straight and align yourself in a straight position, which looks like that. And then after the end pose, we have also a calibration which you have to move, which consists of around moving for 15 seconds. And after that procedure, the system is calibrated. So within 30 seconds, you have had a static calibration and a dynamic calibration, and then you can start measuring with your data.
I will make one addition to that, if I might, Jordi. I do want to check if there are more. Just 10 seconds, I'll make a quick addition to that. Is most of the time when people use Xsens, they think of it as being sort of connected to a computer and you watch the live calibration and you can see the model. But actually the way that this data calibration was done was we did what's called on-body recording. With the link system, you're able to record the data for up to, I think, 12 or 14 hours. So we do the whole calibration system or procedure without ever actually looking at it on the computer. So I have this person every 5 or 10 movements, I have them do another calibration session, so to speak, and then I use that to export the data later. So it doesn't have to be done in the moment. I just wanted to add that.
Thank you very much, Alex. That's a really nice addition to the story. I have another question from Soran. He's basically asking two things, but the first question is, considering the individual nature of movement patterns, do the top use any normative values in the screening of movement quality? So like the top, I think they mean the premium elite athletes. So do you think they have the individual nature of movement patterns? Are there of any normative values which they can use for the screening of movement quality?
If I can, yeah, thanks for that. It's a good question.
Very complex, yeah.
Yeah, this is something that actually, it's a yes and no question, really. Is there are studies published on elite athletes in almost any sport. But when you get to the top less than 1%, top 10th of a percent, the top athletes, the international athletes that everybody knows, most of the time they don't want their normative values published. And this was the work that we did at the Olympic Training Center, is you work to build these sort of data sets that you can say, I've got this athlete, this athlete, this athlete, or this group, this team of athletes, and this is what their normative sets are. So they exist, but you're not going to find them. The way that you're going to get them really is by building them yourself, or if you work with a team that's already been gathering those data.
Perfect. Yeah.
So the last question, do they have any plan to consider the evaluation of soft tissue properties into the injury prevention or prediction model? So do you have any plans for that?
We have a lot of plans, actually.
Yeah.
We have a lot of plans. We could show you only about 10% of our possibilities today. Okay, so we already had calculated much more variables and different angles and different variables and different tests, even for football players and either football players and for the tennis. So soft tissue, I think that it could be also a variable to put on our bucket list. What do you think, Alex?
Yeah, absolutely. I agree.
Mm-hmm.
It's a great question, though. I do appreciate it.
Yeah.
I wish we had more time.
Mm-hmm. Oh, much more.